Can you hear me?
Yes, loud and clear.
Okay, thank you very much. Thank you very much for that introduction. Pleasant afternoon to everyone, Mr. Laksamana, Mr. Kato of Omron. Thank you very much for putting together this very important webinar, as it is really something that is worth considering moving forward. So I think you have my slides. So I am tasked to present to you the new normal in healthcare and the innovations that we implemented to make sure that quality healthcare is still provided to our patients and clients. So basically, the new normal brought about by a single virus that changed every aspect in life around the world. And this brought about economies that collapsed, are now in recession. We have businesses that had to change themselves, and specifically tourism, the airline industry, even entertainment, big events. People now have to work at home, which could be good, but maybe also not so good. Schools have to be conducted at home, all of that. Now, the healthcare industry was not spared. There were many adjustments made, and in the way that we do things, and just to be able to still provide that quality medical care to our patients. One thing that comes to mind is infection control. Infection control was already something that we knew and we follow, but it was more heightened when the pandemic came. So what I will be presenting are the changes that were made by our hospital in our hospital network. Next slide, please. Okay. Am I the one to click this? Okay. Sorry. So one thing that was mentioned by Mr. Laksamana was telehealth or telemedicine, and yes, we also had to resort to this. Basically, these are consults that were conducted online for simple health problems. And this is one, actually, this was a trend even before the pandemic came. There were countries like Malaysia and Singapore who already had some form of telehealth or telemedicine services. And I guess it's true that this was already becoming a trend, but it was just facilitated by the pandemic, because now we are forced to do this. And actually, it was just the pandemic that was the tipping point for this to be accepted. Basically, certain institutions like the Cleveland Clinic already had about 60,000 virtual visits in March last year. And that was from a low 3,400 a month. Now in the Philippines, we also followed suit, and we also had to adjust to this. And now even HMOs joined the bandwagon, because now they accredit telehealth and telemedicine. So the other technological innovations that are now present, of course, you would have tracking apps for COVID-19. You would have quarantine management programs, and even electronic record keeping. it has been now in the forefront, because even just transferring or touching paper that's transferred from one person to another can be a cause of a COVID-19 infection control issue. So all of this now we are considering online appointment scheduling. Before, our doctors never had this. We see the doctors see their patients on a first come, first serve basis. But now, given the challenges of physical distancing, we now have to resort to online appointment scheduling. And then social media and internet, of course, for not only for communicating, but also for advisories and instructionals, announcements, and even marketing advertisement is covered and uses social media in the internet. And then some webinars and online meetings for doctor to doctor, doctor patient relationships are also being now utilized. Now, one feature for hospitals that came about, brought about by the pandemic, is also the triaging system or the triaging unit. Before, you didn't need to do triage because you already assumed that people coming in and out would not transmit the virus to other people. But given the pandemic, we had to now resort to a strict triage process where you do thermal scanning. We had to resort to an online health declaration form, which is what you can see in the screen, because we realized that the triaging, which is an important step, is also actually something that is an inconvenience. You had to add an additional step. And because of this, we leveraged on technology to ease up the difficulties. And actually, given this pandemic, consumer expectations now had to change. And even the metrics for customer service were also had to be recalibrated, because you don't have that person-to-person tender loving care touch that you used to have share with your patients. We also had to do queuing systems because to minimize the crowding of people. So we had to employ certain measures such as that. Aside from that, we had to enhance our infection control practices. So in terms of equipment, we had to invest in negative pressures, HEPA filters, disinfection machines, even using CCTV just to monitor our patients, come up with portable reverse osmosis for dialysis patients, and basically have redundant equipment that would cater to both COVID and non-COVID. And this is quite expensive for us because you had to double up on your equipment. Then we had to develop systems, protocols, and guidelines, such as having algorithms for even just the testing, with the idea that you don't waste resources by testing everyone. You also have to pay attention to air exchanges. Then, of course, as mentioned, we had to enhance infection control practices. So we had to maintain physical distancing, come up with physical barriers. We had to cohort patients, so there were zoning. We needed to provide doning and doffing areas, so that took up more space now. PPEs had to be used and are quite expensive, and sometimes runs into a shortage. So we had to also come up with PPEs that are reusable, just to save on cost for the patient, and also to make sure that we would have enough. And then, of course, signages, advisories, information and education campaigns. And then disinfection was also one thing that we had to pay attention to. As to the types of cases, so of course, respiratory, given that COVID has something to do with the respiratory system, that has become one of the major cases that we had to address. However, there are more ventilators that are required, but less non-COVID respiratory cases were seen. And this is maybe because of fear from both the patient and the healthcare provider. One interesting case that came about was depression and anxiety. So this has increased threefold according to some studies. Was very difficult for not only the patient but also for the healthcare provider, who had to also consider or also fear for their own safety. So this was something that our staff were also subjected to. Now, another adjustment that we did, we was hinged on the premise that we were told by one of our marketing agencies that they did a study, and they found out that 70% of the population does not want to go to hospitals. Maybe it's because of fear, or maybe because of the quarantine restrictions, but they avoid going to hospitals. And so we had to reinvent ourselves with regards to our services and our service delivery. And so we had to reach out to the community and came up with our own home service and home delivery of services, laboratory tests. We also had a drive-through facility, which the local government even recognized, and they gave us a citation for that. We had to resort to online payment system because of the difficulties of face-to-face encounters. Even our company APEs, or annual physical exams, were even done in the company venue itself because they were scared to go to hospitals. And then we also are now venturing into satellite clinics just to expand the reach of the services. Now, as to testing, we've reached that stage where testing was very important. So we made sure that tests are available. We're the only hospital in this area, private, that provides PCR testing. But we're also even trying to improve and make it easier by going to a study for saliva testing, which is supposedly cheaper and faster and more accurate. So no, it's of the same accuracy. So hopefully we will be able to roll that out soon once we get the approval after the study is done. And then recently, vaccination is now the hot topic, as mentioned by Mr. Laksamana. We are now having vaccines arriving, several of them, and we were also prepared to be a vaccination site just to be able to provide the services to our community. This is actually my last slide, but basically just to connect my presentation to the main topic, medical devices now play a very big role given these innovations, these changes in the new normal. And even after COVID, they will still continue to be of use to us. For one, they enable us to expand the data points. If you noticed what was presented by Omron during the present AVPs that were presented, now we look at more data points which help us predict or even diagnose patients' heart problems, given that we have now more data that comes from the patient. Now, it is also important that these devices become more accurate, more reliable, safe, and are able to reproduce the information. It should also be timely or can provide real time. Um, it should be able to be incorporated in the governance structures and into the clinical pathways. Could be useful as to be personalized depending on what the needs of each patient have. It should be interoperable. If you notice that there were several gadgets connected to each other by Bluetooth, these are important. And then secure because of data privacy and all that, and must be remote and portable. Especially for our case, now that we're trying to bring services outside of the hospital and into the community, these devices would be very useful for us because we could bring this to the homes and we can diagnose even if our doctors are not with them. And with that, that ends my presentation. So, Elle, thank you very much.
Good afternoon. My name is Richard Lirio, Product Manager of Omron Healthcare Singapore, and I'm based in Thailand, Bangkok. I've been asked to speak to you about clinical grade BPM during these years with my project, especially Omron Academy. I had many chances to work with doctors in many countries in Asia Pacific. One common goal that I have found from them is to provide safe, secure, and high quality medical care. So today I'd like to explain further why clinical grade blood pressure monitor can help doctors to achieve this common goal. Blood pressure is one of the key vital signs for medical problems. That's why blood pressure monitors can be seen at every stage of patient flow, not only at risk patients but also in general, starting from clinical screening to doctor room or even at wards. Blood pressure monitor devices allow healthcare professionals to collect and examine data from their patients' health record. However, we have still found either manual BPM or home BPM at many clinical settings nowadays. There are two major concerns that the hospitals or clinics do not want to use professional blood pressure monitors. First, their concerns about cost. Market prices of manual BPM and home BPM, as you see from the left side that we try to collect the data, are much cheaper, more than half of prices of clinical grade blood pressure monitor. We compare it with our market prices of current professional blood pressure monitor. Second, some healthcare professionals are still concerned about accuracy. Many doctors still think that traditional blood pressure monitor is more accurate in measuring the blood pressure. However, the concern should be eliminated if we consider the healthcare management's quality issues. First, cost management. If we consider total cost of ownership of home BPM from about shorter product life cycle and more frequent repairing, or if we consider about the usage of only BP reading, so why we have to spend high cost to buy vital signs. Next, patient safety. One of the primary objectives of the healthcare industry is patient safety. Manual BP can lead to inconsistent and inaccurate readings, eventually wrong treatment. Lastly, number of outpatients per day is quite high in government hospitals, while numbers of healthcare professional staffs are limited. This might result to lower patient satisfaction from long waiting time at BP measurement station. Non-professional BPM models are not designed for this kind of usage. We see these issues in hospital channel, and we want to be part of society to promote good initiatives of hypertension management in clinical setting. While we believe that we have the competitiveness over the competitors or even the current manual BPM, we keep investing on R&D and patents to be industry-leading innovation. To prove it, Omron Corporation has been selected as one of the top 100 global innovators in 2021 by Carrivet for the fifth consecutive year. Are well designed for simplified function and usage. And lastly, models are tested according to protocol of three major standards in the global organization: AAMI, ESS, and BSS. On our medical product lineup, we classify product segment into two segments. The first segment on the lower, three model lower, we call it upper arm BPM. And the above segment, the top segment, 9030 and 9031, we classify it as the full auto BPM. So both segments are designed for different variety of usage. As today I have limited time, so I will not mention product specification of each model, but I will explain the overall key points of clinical grade upper arm, so you can have the overview picture why clinical BPM are built for the professional healthcare environment. First, these three models, we provide latex-free, wider range of cup option with intelligence technology. So this suitable for adult and children starting from age 3 years and older. Second, our product has been designed and already validated that it have higher longer product life cycle, 10 times more than longer than the general home BPM. Next, for this model, 1320 and 907. We also provide the rechargeable battery, which is this model can be used like a movable or portable that healthcare professional staff can carry it anywhere. Next, about the configuration. So we provide both the configure for both initial inflation pressure value and also auscultation mode. In auscultation mode, the healthcare professional can use the stethoscope to determine SYS and DIA of patients. Next, it's easy to use. The model already designed for the function because we know that it's crowded. So time is precious for the healthcare professional. The function has been designed on the high the large button and also the large display. So the healthcare professionals can click it easily or even change the mode easily and also see the result easily to interpret the result faster. Last but not least, these models also validated by the past the standard AAMI. So you can believe in their accuracy. For full auto BPM is specifically designed to use for the hospital and medical facilities with the high number of outpatients per day. So we try to design the product that lessen the BPM waiting lead time. Patients can measure by themselves. So once patient insert their arm, they receive the BP and show the result. This is also good for any healthcare who concerned about the hygiene amid the COVID-19. So patients have the cell BP and the BP result shown on the printed paper like this, or even it can transfer via USB data to EMR if the facilities already have implemented the system. And HBP 9030 also designed for users either right-handed or left-handed. You can see that there the button there on both left side and right side. And to have more accuracy BP result, HBP 9030 has arm detection function to detect the right elbow point once the user insert arm into the cuff, and also provide measurement posture illustration display with audio navigation to guide patients step by step during self-measurement. The model has been validated and passed the accuracy standard. This is the final slide to sum up that this model designs for professional use. Medical grade devices can cover a vast range of patient age, starting from over 3 years old, and also can cover a wide range of hospital and medical facilities. The device helps improving quality of healthcare management in the long term. Thank you for your attention. If you have any inquiry, please feel free to connect with Medhyve for further information.